Good morning, everyone, and welcome to the 2021 Family Strengthening Network Summit. My name is Charlene. I'm the director of LA Best Babies Network, and I will be your MC for today. This is our 6th summit since 2015 and our 2nd virtual one. And the theme for today is ever so fitting, Home Visiting Works, honoring the Changemakers, you. Today, we are celebrating the accomplishments of the Family Strengthening Network over the last year. The network consists of over 675 staff from 14 hospitals and 26 community-based organizations, representing 3 home visiting models: Welcome Baby, Healthy Families America, and Parents as Teachers, and multiple funding sources: First 5 LA, Department of Mental Health, Department of Public Health, Department of Public Social Services, and CH3P state dollars. And what's great about today as well is that we have guests from other home visiting models in the county as well. So big thank you to our guests from Early Head Start, Nurse Family Partnership, and Mama's Neighborhood for being here as well. I'm extending a warm welcome to all of you. As I speak to maternal and child health, early childhood education, and home visiting professionals across the country, and specifically in Los Angeles County, I'm inspired. Your unwavering dedication to families helps me wake up every day and dedicate myself to the same cause. I've noticed that many of us are ready for a tectonic shift in the field as well, a shift that emphasizes the focus on the individual, the interpersonal, the institutional issues that shape future generations' lives. The Family Strengthening Network sits at a unique crossroads, directly between trauma and transformation. When I say transformation, I'm referring to that in a holistic sense, for you and the families we serve. Not just when you put on your superhero capes as a home visiting professional and dive in to help others, but also your own growth, your self-awareness, recognition, and learning that goes into identifying and dealing with your own personal challenges, which in turn allows you to be able to better serve our community and family. Research says that people do better in the aftermath of trauma if they find work that benefits others, helping people close to them or their broader community, helping victims of events similar to the ones they've endured. I see this as the power of healing in our own community. For years, we've been talking about the power of healing, trauma-informed care practices, health equity, and well-being, and what we need to practice in this field. We need to rethink about how these concepts can be woven into the very fabric of our community and work. Healing and well-being are rooted in Indigenous and many cultural traditions. They're not new concepts, but we need to bring them back to the forefront. The pandemic has not only given us an opportunity to reevaluate our own lives, but has given us an opportunity to reevaluate how we do our work. You may be asking yourselves, how do I implement these principles into my own world? At a time that our community and families were feeling most vulnerable, this network continued to step up and provide quality services to families. That's not to say you didn't experience your own loss, confusion, feelings of fear and uncertainty, and for that I am truly sorry. But what I've also seen is your resilience, and what I also see is that resilience shining through our clients. Transitioning to a virtual world was quite a journey, and we've made it. And it's important to note at some point we will transition back to the root of this work, cultivating the one-on-one direct services with our community members. And guess what? We'll make it then too. We know that negative experiences can spur positive change, including a recognition of personal strength, the exploration of new possibilities, improved relationships, a greater appreciation for life, and spiritual growth. We see this in people who have endured trauma, war, natural disasters, bereavement, job loss and economic distress, serious illness and injuries. So despite the misery resulting from the COVID-19 outbreak, many of us can expect to develop in beneficial ways in its aftermath. Although post-traumatic growth can happen naturally, it can also be facilitated by providing education, social support, skills to emotionally regulate, empathetic communication, motivational interviewing, and a safe space to reflect. All of these are aspects of the foundation of our home visiting models. This is the essence of our work, and what a time to be in this field, when our families and community needs us the most. When and if this is all ever over, we may find that we are stronger and closer to one another than ever before. Now, before I go any further, what's a summit without a corny joke? So here I go. I wish I could see your reactions. I miss being in person, but I'll have to go with the virtual vibe anyways. What is the strongest rock in the world? I'll give you a second, think about it. Dwayne Johnson. All right, you're welcome. I hope you giggled a little bit. I have no idea if you did, but nonetheless, if that wasn't a corny joke, I don't know what is, and I'm full of them. I also want to take a moment and recognize the staff who didn't have the opportunity to work from home, let alone those who never left the bedside. Hospital liaisons, I'm looking at you. I know at times it was scary and the constant change in information didn't help, but I'm grateful to each one of you for continuing to show up in a time that was filled with uncertainty, not only for you, your hospitals, but for our families as well. But I promise you, your generosity and the kind smiles behind your masks will be remembered by our clients and families. We also know that we still have work to do. Collectively, there is roughly about 33,000 slots for home visiting across multiple home visiting models in the county. Welcome Baby, Healthy Families America, Parents as Teachers, Nurse Family Partnership, Early Head Start, Mama's Neighborhood, Healthy Start, and Partnerships for Families, just to name a few. Yet we also know that there are over 865,000 children between the ages of 0 to 5 years old each year that need services. I'm happy to report that there are multiple efforts taking place on the end of the county focused on long-term and sustainable funding through insurance reimbursement and federal dollars. While I've still got this stage here, I'd like to take a few moments to say a few special thank yous. First and foremost, I'd like to thank First Five Los Angeles. A heartfelt thank you to the leadership, program officers, and all the background staff supporting us and continuing to believe in this vision and mission in this work. Thank you to the Los Angeles County Department of Mental Health, Public Health, Department of Public Social Services. Over the last years, we've been able to expand home visiting with their support, and I'm appreciative of their implementation team. Members of the Family Strengthening Oversight, Maternal Child Health Access, Work to Live, and PACLAC for their ongoing support, guidance, and involvement in pushing us to reach excellence in the work we do. And last but not least, the LA Best Babies Network team. I'm ever thankful to each one of you for your unique skills and talents you bring to our table. This last year, I've seen you all go above and beyond your roles and responsibilities, all for the same vision and passion: equity, justice, and service for our community. Thank you for all the work you do. Thank you for always having a positive attitude, bringing creativity and laughs to our table. I appreciate each and every one of you in your daily work. I'd also like to extend a special thank you and appreciation for our Executive Director, Dr. Yana Kura, for her leadership, mentorship, and belief in us. And I'd like to also note the California Hospital Medical Center leadership, notably Alina Moran, our hospital president, for supporting us and providing the space and resources that we need to make this work happen. We have an energetic group of presenters today. In just a few minutes, we'll hear from the Vice President of Programs for First Five LA, the Deputy Director of LA County's Department of Public Health, along with California Hospital's President. We will hear from the LABBN team about the larger home visiting systems work we do. We will review the data over the last fiscal year across the models, and we'll hear directly from two families about how home visiting impacts them. For our keynote, we will be hearing from Dr. Junlei Lee from Harvard University about being more than one thing and finding more than one way. And we'll close out our event with our spoken word poet, Avi Silver. Now, before going any further, I just want to take a moment and identify a couple of logistical things. You'll notice that you cannot turn on your camera, and that's okay. Because we're in a webinar, very large conference format, we don't have that option for you today. Please make sure to stay muted because we want to make sure we provide enough. We don't want to let anyone be disrupted by noise. You're more than welcome to use the chat box and the QA box at the bottom of the screen to interact with panelists and the hosts. Please note that you cannot chat with each other. That option is not available to you. Hopefully you've been able to review the summit material today. It included the agenda, the speaker bio, and presentation material. All of that can be found in the Eventbrite link. And then of course, your summit goodie bag, or I should say your goodie box. I've got mine right here. There's a lot of wonderful things in there, including a snack that hopefully you can enjoy at some point. You may all remember that on that goodie box, there was a QR code that scanned to our thank you letter to all of you, along with an opportunity to join the raffle. So we'll be raffling off 10 prizes throughout the summit today. I'm excited for that. And of course, allow us to experience the summit through your eyes. Share your selfies, group photos, and favorite moments during today's events on social media using the hashtags #StrongerFamiliesLA and #HomeVisitingWorks. And don't forget to tag LA Best Babies Network on Facebook, Twitter, or your Instagram posts. Like I said, there's a lot to cover this morning. And while I wish we were somewhere in a fancy banquet hall doing this all in person, we couldn't miss another opportunity to celebrate and honor all of you, the Changemakers. My personal hope for today is that each and every one of you leaves this space feeling valued, appreciated, inspired, and feeling like the change maker that you are. Without further ado, I'd like to invite John Wagner, Executive Vice President of First 5 LA, to give us his opening words. Thank you.
Thank you, Charlene, and good morning and welcome to the Virtual Family Strengthening Summit. My name is John Wagner and I'm excited to be able to join you for today's summit in my new capacity with First 5 LA's Center for Child and Family Impact, formerly known as the Programs Division. Joining me from the First 5 LA family are a number of staff and one of our commissioners, Romalis Taylor. I also especially want to call out and thank Deanna Cariaga, our Director of Family Supports, for her significant role and contribution to organizing today's summit. In addition to acknowledging my colleagues, I also, like Charlene, want to acknowledge and thank the Family Strengthening Oversight Entity members, including Los Angeles Best Babies Network, Maternal and Child Health Access, Work to Live, and PACLAC for their tireless work supporting the successful implementation of these programs. It's really an understatement to say this has been an unprecedented year and a half. When we all left our offices back in March of 2020, we thought perhaps we'd be back in just a few weeks. And yet here we are, some of us back conducting visits bedside, in the hospital or working in the office, but most of us still largely providing virtual visits. We had to shift a foundational piece of our home visiting work from the home to a virtual platform. From creating a virtual cohort training to learning DocuSign and Zoom, it's been a tremendous pivot in our practices and the ways we connect to families. We know much has happened in the last year to you, your colleagues, and the families you serve, both professionally and personally. We applaud your tremendous fortitude and commitment to one another and to the families you serve. Next year, we look forward to celebrating together safely in person, and we even have a place already reserved and ready to go for June in 2022. Before I turn this back to Charlene, I really wanted to say a few brief words around three themes. First, our collective vision and partnership work. Second, learning and sustainability efforts. And finally, policy efforts for systems change. So first, our vision and partnership. As you all know, home visiting is meaningful work, not only to LA County, but for the state and the nation. We continue to have eyes upon us. LA County has more people than those residing in 42 states. We often refer to our home as the nation state of LA, and what you are doing matters and makes an impact on the field here at home, across the state, and nationally. This past year, we've worked closer than ever with our partners, including the Los Angeles County Departments of Public Health, Mental Health, Public Social Services, and others. And together, we all responded last year to a board motion that identified the county's unmet need for home visiting services, calling for more programmatic options to expand and diversify models of home visiting, and funding needs and opportunities to achieve an appropriate level of home visiting services across the county. This group of leaders submitted a response back to the board in August of 2020, which demonstrated a collective commitment across Los Angeles to build a highly integrated, comprehensive, family-centered system of home visiting services. And we have the critical contributions, input, and support across the system as well, such as with the partners I mentioned, LABBN and the Home Visiting Consortium. All of this is to say, we could not do this work alone. Second, learning and sustainability. We've been actively working to find ways to sustain the system, as it is a significant investment for the First 5 LA board and a significant contribution to the larger tapestry of supports and services for families with very young children. As we know, COVID profoundly impacted our daily work and that of families. It also affected other efforts, such as our planned Welcome Baby Impact Study. Given the stressors and needs families were facing, we did not think it was appropriate to embark upon a randomized clinical trial. So we pivoted from an impact study to a virtual implementation and outcome study. There is limited data and knowledge about virtual home visiting in the national field. So those of you in Welcome Baby will be able to contribute to greater understanding and learning for your peers and other programs in Los Angeles, as well as nationally. to better understand the role of virtual visits in supporting and enhancing in-home visiting programs. You know as well as we do that sustainability is not a clear linear path, and we're experiencing today that fact with some contract reductions. It will take all of us continuing to work together, bringing in new partners to maintain the critical resources needed for this important work. For the past 2 years, First 5 LA has also been working with health plans, ensuring they understand the benefits of home visiting and exploring what outcomes are of most interest to them. Continuing to create these relationships and partnerships will be key to our efforts to enhance the sustainability of this system. Third and finally, policy and systems change. Aside from our focus on learning and sustainability, we work hard to influence policy changes in the system level as well. One thing that this past year revealed is the heightened inequities and disproportional impact on African American, Hispanic, Latinx, and Native American communities in particular. The economic pressure the pandemic has placed on the country's most under-resourced families exacerbated the racial divide and widened the margins of racial disparities. Home visiting is an important strategy to provide families with needed support and linkages to services. Together, we helped meet basic needs. Many of you remember the extra diaper donations facilitated via Baby to Baby and the availability of Chromebooks and hotspots for families via DPH's COVID funding and LABBN's logistical support. Though these resources are important, it's your presence for these families that helps to create connections, address social isolation, and link families to needed services. We will continue to work towards creating and implementing strategies that address racial inequities and are culturally responsive and appropriate for the families we serve. And of course, this year's state budget has some promising proposals, including for CalWORKs home visiting, with $30 million in funds for 2022 through 2023. Protecting the CalWORKs home visiting program from budget cuts was a major First 5 LA legislative priority and a key focus of our Advocacy Day meetings earlier this year with legislators and staff. In closing, what a year this has been. We continue to learn from you and with you. We knew creating a new network of providers working together as part of a system would be challenging work. We knew establishing referral pathways between all of you would be challenging. And it's an area we continue to monitor and work to provide support. We knew creating systems change for a unified home visiting system would require significant coordination and partnership. And we are proud to work alongside the Department of Public Health and other county entities to better integrate all of our efforts. There is still so much change happening as vaccination rates increase and you have more opportunity to see families in person, even as virtual visits remain an option in some way, given that it works well for some families. All of you were able to continue this critical service during this life-changing year. So congratulations and thank you for your commitment and amazing work. With that, I'll turn it back to Charlene. Thanks, Charlene.
Thank you so much, John. I really appreciate your words, and I really appreciate you highlighting what the future of home visiting is going to look like as well. Next, I'd like to invite Dr. Deborah Allen, Deputy Director of the Department of Public Health.
Thank you so much, Charlene. It's a real delight to be here and to speak for the department, including Dr. Barbara Ferrer, who is my boss, and for Linda Aragon, who is the director of our Division of Maternal, Child, and Adolescent Health, which is where our home visiting work is based. And thanks, of course, to all of you for your continued commitment and zeal in supporting families across the county. You are indeed the change makers. I firmly believe that helping moms and dads connect early to the services they need, giving them a supportive shoulder to lean on when their going is rough, coaching them through the profound ups and downs and past the minefields of early parenting. These are life-changing contributions you make to families. So home visiting is a really powerful tool. And for public health, the connecting of families to health services and health-related services, and the support for families who are experiencing stress are really critical elements in promoting lifelong health for families and children. But the last year has definitely been a tough year for home visiting. It's been a tough one because while we have learned that remote contact can work, it has some very real strains, and for some families may actually be a preferable method of connecting. It's not generally optimal for achieving that personal bond on which successful home visiting depends. We know that that's about trust, connection, personal connection, and the face-to-face contact is really irreplaceable for most families in achieving that. It's been a tough year for the program on a system basis because while we've had some successes in bringing in new funds for various kinds of home visiting, we have some irons in the fire, I should say, for looking for additional funds from both county and federal sources. There have also been some losses of funding that have been important and that make it difficult to maintain, much less achieve the growth that John talked about that we're really aiming for in the program. And probably most importantly, it's been a tough year for home visiting because so many members of the home visiting family have faced their own personal COVID-19 hardships, whether it's through personal illness, loss of family income, loss of schooling, and the social growth that comes with schooling for your children and ours, and most tragically, the loss of loved ones. 24,000 lives lost in Los Angeles County alone, 62,000 in California, over 600,000 in the United States. Our hearts go out to those of you for whom these statistics really stand for deeply personal losses, and we know that that's true for many of you. So a very tough year indeed. How do we get past the challenges of the past year to build back and to build better for the coming year and into the future? For DPH, and this is true of our partnership with other county departments and with First Five, a critical focus is on the quest for funding, not only to grow home visiting, but to assure stability in the program, to really make it a rock solid foundational part of social services and health services, because we see it as a health service in Los Angeles County. To that end, we're working with partners to assure that as Medi-Cal moves forward with its CalAIM strategy for the future, that includes enhanced case management as a basic service, that home visiting is right on their radar screen as the way to provide enhanced case management for pregnant women and for families with new children, young children. We really want to make sure that we take advantage of the possibility for that stable, ongoing funding stream as the base payment source for home visiting, because we believe that it's only when a program is supported by that kind of stable government money that we can expect it to survive into the future and to grow to the essentially universal program, or at least universal option that we would like it to see for all new families. So we all need to think about what it's going to take to get there, to make this program fill that vision for payers of what good enhanced case management would look like. To make that case, I think it's going to require that we have a really firm track record of effectiveness that we can point to across the program, assuring quality and productivity across models and sites, broadening the value and the appeal of the program to women who have frankly been skeptical. And particularly, I want to note that that's been true for many Black women, modifying models so that they meet the needs of and the preferences of a very broad range of women at all levels of risk. And to do that, we really need to think of ourselves not just as champions for a particular model of home visiting. At DPH, we are, of course, the home to the Nurse Family Partnership, but we need, like everyone in this, well, not this room, but this virtual room, to think of ourselves as collaborators in a broad system that has a wide enough variety of models to serve women with a variety of preferences and needs. In particular, payers are going to be looking for us to be able to serve groups of women for whom they are particularly accountable. And those include women who are at the highest risk within the healthcare context. So homeless women, women who are leaving incarceration, women who have serious emotional disturbances, women who have substance use disorders. Those are groups we're going to be able we're going to need to be able to serve. We're going to need to have models that are flexible enough to meet the needs of women whose lives are particularly unstable. That's going to require a system that is extremely nimble about figuring out how to get the right service, the right model, the right level of service to each woman, each family, but is solid enough and sort of consistent enough across the board to assure a high quality service for women at whatever level of need they are and with whatever model they're coming into the system. These are very big challenges, but we are a big group and we have big dreams and big strengths to bring to bear on those challenges. And the meeting those challenges, I believe, is really critical for the growth and the survival of this wonderful program that's so important for families. As change makers, I believe you are the right people to take this on. So we look forward to working with you over the next year, this really crucial year because of the shifts in how Medi-Cal is operating, to cement home visiting as a fundamental, secure, stable program for all new families in Los Angeles County. Thanks so much.
Thank you so much, Dr. Allen, for your words. And last but not least, our very own California Hospitals President, Alina Moran. Thank you.
Thanks, Charlene. And I wanted to thank Mr. Wagner and Dr. Allen for their words. So welcome to the 2021 Family Strengthening Network Virtual Summit. I would like to commend the nearly 750 staff members in over 14 hospitals and 26 community-based organizations for really serving as change makers in the community. I would also like to extend my thanks and just best wishes to Dr. Yanakor, Charlene, and the rest of the team for their efforts and leadership on a day-to-day basis. Through our collective efforts, we have strengthened and supported the health and resilience of our expectant and parenting families in LA County. Despite a very challenging year, the LA Best Babies Network hosted and facilitated over 200 individual trainings. We also trained over 100 new staff members and transitioned seamlessly from in-person home visits to virtual home visiting. At California Hospital, we are deeply committed to investing, supporting, and providing outreach services that empower children and families to take charge of their health and the health of their communities. This is why we will work closely with the LA Best Babies Network, the consortium, our community partners like First 5 LA and the Department of Public Health and Mental Health to strongly advocate for additional funding and to really expand the eligibility for home visiting services across the county and hopefully be able to take that across the state. Thank you again for participating in this summit, and let us continue to work together to highlight that home visiting does work and to honor our change makers that are making a difference every day in their community. Thank you.
Thank you so much, Alina, for your kind words and inspiration as well. To get us moving, I think it's probably time for one more joke before our next presentation. So here it is. Why don't you use a dull pencil? Why don't you use a dull pencil? Because it's pointless. All right, you're so welcome.